going to be a short one, and we are talking about principles of clinical management of poisoning. From our previous lecture, we said that a poison is a substance. It can be in the form of a liquid, it can be in the form of a gas, it can be in the form of a solid. And if it is introduced in the living body and is able to produce ill health or death, any substance that's able to do that is called a poison. You recall from our previous lecture that we mentioned that poisons actually can be classified. So in terms of classification, poisons can be classified according to the effects they cause. So if they are causing local effects, they are called local types of poisons. If they are irritants, if they cause irritation, then they are classified as irritants. And there are those that can go into the systemic circulation and cause some effects, and these are systemic poisons. And then we have the miscellaneous poisons. So under the local poisons, you will find, this is where you find acids and alkali. So within those, in terms of the acidic ones, you're going to find the organic and the inorganic poisons. Okay, so it's true with the irritants. So you're going to have the organic and the inorganic irritant type of poisons. And we'll be talking about, we'll discuss more of this in the next slide. So this is the just classification of the poisons. You have the local ones, you have the irritants, the systemic, as well as the miscellaneous one. Now, in terms of the local poisons, this is where you find the corrosive poisons. And these can be strong acids or strong alkalis. The strong acids, in this group, you have sulfuric acid, for instance. You can have hydrochloric acid, nitric acid, and so on and so forth. Those that are mineral acids. And then you can have organic acids. Organic acids will include the carbonic acid, the oxalic acid, acetic acid, and so on and so forth. Then in terms of alkalis as local poisons, you can find the carbonates, sodium, potassium, or ammonium. You can also have metallic salts, such as zinc chloride, iron chloride, copper sulfate, and so on and so forth. You find them as alkalis. Then for systemic poisons, they are classified according to the system they affect the body. So if they affect the CNS, these can be called CNS depressants. And among them, you have got alcohol, some opioid analgesics, some hypnotic drugs, and also sedative drugs that can depress the central nervous system, and so they are called CNS depressants. And then you can have the CNS stimulants, those that stimulate the central nervous system. And here you have drugs like amphetamine, drugs like caffeine, cyclic antidepressants are good examples of those that can stimulate the central nervous system. Then we have the deliriant poisons, and these will include drugs like cannabis. If they cause delirium, for instance, they are classified as deliriant poisons. Drugs like cocaine, they are in that category. Then we have the spinal poisons. Spinal poisons, the good example is the Nux vomica, which can affect the spinal cord. So in that class as well, there are quite a number of them that you may want to read more about. Then we have the peripheral poisons. Those are the ones that act peripherally on the body. And these can include curare as one of them, or conium. These are poisons that act peripherally. Then we have those that affect the cardiovascular system. And among them, when you're talking about the drugs, this is where you find quinine. Even drugs like nicotine in tobacco also can affect the cardiovascular system. So they are cardiovascular poisons. Then we have asphyxiants. These are the type of poisons actually that can affect the respiratory system. They include carbon monoxide, carbon dioxide, and so on and so forth. So in terms of irritant poisons, we have the inorganic and organic ones. So in terms of the inorganic poisons, this is where you have metallic and non-metallic poisons. Okay. Sorry for that. I think we had run out of time, but I've just refreshed it. Are you able to hear me?
Yes, sir.
Yes, sir.
And able to see the slides?
Yes, we are.
Very good, very good. So I was talking about irritant poisons, and these we classify them as inorganic and organic poisons. And in inorganic group, this is where we find non-metallic, metallic, and mechanical. And you can see those examples in each one of them. Non-metallic, it means that these are poisons that are not metals in nature, like phosphorus, like chloride. They can be poisons because they are non-metallic. Then the metallic ones, those are metallic in nature, such as copper, lead, silver, zinc, etc., etc. And there are those that are mechanical in nature, such as diamond dust or hair. Those are mechanical poisons. Then the organic ones come from the vegetation as well as from the animals. So those from vegetation, you can have like castor oil or castor substances that can be classified as organic poisons. Then from the animal, you can have venom, for instance, from the insects or from the snakes. Those are poisons that are classified as organic. Then these poisons, for them to have an effect, I think we had touched on this, they have to get into the body through a route of administration. So in terms of route of administration, quickly just to go through is that we have the inhalation, we have the injection into the body through the blood vessels. We have also the intradermal or subcutaneous or intramuscular, if you like, also. Then we have also application onto the serous membrane or the mucous membrane. We have also introduction into the stomach, those that can get by ingestion when you ingest a poison and gets into the stomach. Then we have also those that can go into the natural orifices. Yeah, and then we have the rubbing route, which can get into the skin by way of coming into contact with the poison. So the question is, what can affect poison action. So there are many things that affect poison action. As you may already know, quantity is very important. You know, how much of the poison is getting into the system. So the higher the quantity, the severe the actions may be of that poison. Also, the form of the poison. So there are poisons that act more rapidly, especially those that are in gaseous form. So what form is it? Is it in solid? Is it in liquid or gas? So gaseous ones will be faster in terms of action. So in terms of action of a poison, a gaseous poison will be more, will act more faster than the other types. Then also the mode of administration. So if somebody ingested as compared to somebody who's been injected, so the injection one may be faster than the ingestion one. Then also age. So the two extremes of age, the very young and the very old, the infants are likely to get more, the poison is likely to act more faster in the infants than probably in an adolescent, for the reason that the organs are not developed enough to metabolize the poison. Or in the very old, because the physiological system is diminishing, and so they may not be able to metabolize the poisons as fast as possible in order to detoxify the system. And so the poison is likely to work much faster in the aged. There is also idiosyncrasy. This is like the inherent, just individual sensitivity to the poison. There are people who are more susceptible than others. Then also the issue of habituation. People who've been exposed to poisons at a lower dose for a long period of time tend to have decreased sensitivity to that poison. And so that results from actually decreased reaction between the chemical and biological effectors in the system. The other things that can also affect the action of the poison is the state of health. So somebody who has other underlying conditions, they are likely not to tolerate the poison as much as somebody who is in good health. So a healthier person tolerates better than a diseased person. Sleep can actually slow down the action of a poison. That's what has been shown. Why? Most likely because the hemodynamics are very slow during that time, and so the poison is not able to distribute to all parts of the body easily. So sleep and intoxication entails that the action of some poisons get delayed if a person goes to sleep. Then there is also the cumulative action of a poison. Some poisons, if somebody is exposed to a poison for a long period of time, because of slow elimination from the body, they get to accumulate. So that also affects the action of the poison, meaning that those poisons which are slowly eliminated from the body may gradually accumulate and then may produce some poisonous symptoms. So is it easy to tell that somebody has been poisoned? Probably the answer is not, but there are certain symptoms that can guide. But no one symptom or a group of symptoms can really indicate that somebody has been poisoned. But a case of poisoning, it should be suspected if the following things are observed. For instance, if symptoms appearing suddenly in an otherwise healthy person, there you can suspect. All of a sudden, somebody has got symptoms, probably has got diarrhea, or they have got nausea, and they are just in good health. You may suspect that there could be some, so you can suspect poisoning. Also, you can suspect poisoning if symptoms are appearing within a short period of time after taking some food or a drink. As the case may be, maybe you are attending some wedding or you are attending some meeting and you are served with food and drinks. And upon taking that drink or food, you develop symptoms such as nausea, vomiting, diarrhea. Then you might suspect that maybe poisoning has taken place. Also, in a group gathering, if similar symptoms occur, if you are in a big group and you are consuming the same foodstuffs or drinks, and then almost everyone else is complaining of the same symptoms, chances are that there could be poisoning in those situations. So symptoms that are suggestive of poisons are many, but some of them, we can know them depending on the type of poison that is involved. For instance, if it is arsenic poisoning, that happens. So there is sudden onset of abdominal pain. There could be nausea, vomiting, and diarrhea, and probably coma as the person collapses. Then if it is organophosphates that are involved, there is sudden onset of coma and constriction of the pupil. And this happens also with opioid analgesics. Yeah, so I was talking about who are brought in dead into the health facility and they are pronounced dead, and you don't know whether it was poisoning or it was something else. But there are certain things that should be able to guide whether poisoning took place. One of the things is the cause. Henry, you haven't muted yourself. Okay. Yeah, so the other thing is the color changes. For instance, the mucous membrane or the skin has changed, and you should be able to suspect poisoning. Then also the smell or the odor is supposed to guide whether somebody was poisoned. There could be a garlic-like smell, you know, usually, especially with if the poisoning involves some gases like arsenic, a sweetish smell, or acrid type of smell, or rotten egg smell. All those are indicators that poisoning could have taken place if somebody has been brought in dead. Then also you look at the marks on the body. If you see that maybe there was some injection, it could be that some people were abusing drugs, and in the process, they intoxicated themselves and got poisoned. So you can see actually the injection marks on the body if the body is inspected. Also, when you look at the skin, if there is hyperkeratosis or there is jaundice in the eyes, you should be able to suspect poisoning in the people who are brought in dead. Then, in terms of chemical analysis, so organs can be used to analyze the chemicals that have been involved, and usually these organs are kept in containers which are free of contamination. Also, in chemical analysis, they want to take specimens such as blood, urine, bowel, and analyze them and keep them in a container that is also free of contaminants. Then the specimen choice is important. Please, Henry, don't unmute yourself. Then you can also use urine, which is ideal in some cases, where you can easily analyze the urine specimen for poisonous substances that may be in there. So in cases where there is decomposition of the body, somebody is brought in dead and they have decomposed. So usually it's the thigh muscle, the thigh muscle that is sampled out to check for poisoning. And it's very helpful in terms of the body that are decomposed, because this thigh muscle does not easily decompose. It is important to keep the liver and the kidney separate from the alimentary canal contents, so that you are able to analyze how the poison was able to move. Because in the liver, it will have been metabolized, and in the kidney, it is being eliminated. And so you find that the parent drug or the parent chemical may be different from the metabolite. You want to separate the two and see and make some correlation between the parent chemical and the metabolite. Then in terms of analytical procedures, there are steps that are involved. So you need to separate the poison from the biological tissue, because the poison will have entered or will have been distributed in the tissue. So the first thing is to separate the poison from the tissues. Then the purification process should be done. So it's a meticulous process that requires step-by-step analysis. Then analytical detection, you can use even simple chromatographic methods such as thin layer chromatography, or you can use sophisticated ones such as high performance liquid chromatography. Others that have been used techniques include the gas chromatography or UV spectrometry, or immunoassays have been used as well. And the immunoassays will include enzyme immunoassays or fluorescent immunoassays or radio immunoassays. These have been used as procedures in analyzing the poisons. Then there are factors that influence toxicological analysis. Like we mentioned earlier, age is one of those factors that can affect toxicological analysis. So if somebody is able to, is of adolescent age and they're able to metabolize the drug, it's very difficult sometimes to get to know which was the parent drug, because you find mostly metabolites. Weight also, meaning that the poison could have gone into some other tissues and be deposited in there, like in fat tissue. So those poisons that fat soluble, they will easily get deposited into the fat. So weight is very, very important aspect when it comes to factors influencing poisoning analysis. Then also the presence of natural disease. In a disease state, it may mean that maybe the kidneys are not working properly to eliminate the substance, or the liver is not metabolizing enough. And so the presence of disease also has an impact on the analysis of the poison. Also the traumatic lesions. Okay, if there was too much trauma and there was probably a lot of bleeding and so on, so that can also affect the analysis. The degree of tolerance as well. There are people who can easily tolerate by way of easily metabolizing the poisons. Others may not be able to metabolize the poisons that easily. Then also the issues of hypersensitivity reactions. There are people who are hyper and easily susceptible to poisons. Then in terms of, okay, I'm still accepting some people, admitting some people who are just joining. In terms of the rules of treatment, so we follow and this is very important. Are you able to see the screen here?
Yes, sir.
Yes. So this one is very important, the general rules of treatment. So this is where we have the ABC. So the first thing, if somebody is brought in who is been suspected to have been poisoned, the first thing is the airway, able to breathe properly. And if although they are able to breathe properly, but there's a strong suspicion of poisoning, the chemical involved is known. So you look for an antidote. So you look for a substance that can neutralize the poison, which is an antidote. So the next step you move after making sure that the airways are okay and the antidote has been administered is to look at the breathing itself. Is that person breathing properly? So you continue monitoring the respiratory tract on how they are performing. Then the circulation, make sure that blood circulation is proper. And also you want to decontaminate. So decontamination, remove the poison, okay? And then during that process, the D itself also could mean that you want to administer a drug or you want to administer a fluid that will help, like dextrose. So that's the ABC that you need to know, okay? Then you can also go ahead and do the removal of unabsorbed poisons. So it could be, if it is a inhaled poison, then you want to provide fresh air or ventilation. If it is injected poison, you want to do a ligature application. Then if it is contact poison, immediately you want to remove the clothing, or you want to wash the skin thoroughly so that the poison is removed. Then if it is ingested poison, you want to do a gastric lavage, okay? So gastric lavage implies putting the tubes into the stomach and then pumping out the content of the stomach with the poison. That is gastric lavage, and it can be done in several ways. Sometimes there are nasogastral tubes that are put, or you can put the tubes straight into the stomach. Okay. Then in terms of the gastrointestinal decontamination, emesis, meaning you can induce vomiting. But here one needs to be very careful on how they do that so that there's no aspiration of the gastric content. So emesis can be induced. It is only useful within the first 3 hours of ingestion of a poison. After that, it means that the poison could have been distributed to all parts of the body, and it would be very difficult for it would be useless to use emesis. So there are certain drugs that can be provided, like epecac syrup. It can be given to induce vomiting. Then also you can use activated charcoal. So if today you go into some of these retail pharmacies, you're going to find what is known as medicated charcoal or activated charcoal. It is useful also just within an hour of ingestion. Thereafter, it may not work because it works on the principle of absorption. So the poison has to absorb onto those small particles of the charcoal, so that later on they are removed from the body. So gastric lavage also is useful, like we mentioned, but also it's useful within the first 3 hours of ingestion of a poison. After that, it's useless. So tubes can be used, and there is a tube called the Boas tube or the nasogastric tube that can be used to decontaminate the gastrointestinal part of the body. Then there are antidotes that can be used in the management of poisoning. So there are those that are physical antidotes. Physical antidotes, they neutralize the poison by mechanical action or prevent their absorption. They will prevent absorption of the poison. These include the one that we've mentioned already, the activated charcoal. So these particles, which are small, the charcoal particles, they have very high absorptive capacity and acts mechanically by absorbing, not absorbing, but adsorbing the poison from the system. So activated charcoal can be used if there is maybe barbiturate poison, like if somebody has been poisoned with phenobarbital, if you like, or diazepam, for benzodiazepines. So you can use that. Or if somebody has got an opioid poisoning, you can use activated charcoal, atropine, and so many other drugs that can be used for, you can use activated charcoal for. So less useful in corrosive. So if somebody has taken an acid or a heavy metal, activated charcoal may not be useful at all. So you need to know the type of the poison that is there and the antidote that can work for that particular type of poison. Then you can also use what we call still the physical antidotes, which include denucents. So denucents are simply substances that form a protective coating along the gastric mucosa, and thereby preventing the poison from being absorbed or damaging the mucosa as well. So the examples of these, you've heard some people in this poisoning, they talk about administering milk or starch or egg white or mineral oil or milk of magnesium. So these are denucants. They just coat the lining of the gastric mucosa and they prevent the corrosion of the mucosa as well as the absorption of the poison. So here care must be taken. For fats and oils, should not be used for fat-soluble poisons like kerosene. So if somebody has taken, a baby has taken kerosene, for instance, you cannot use an antidote that is fat-based or oil-based antidote. Cannot be used. Then you can also use, among the physical antidotes, bulk foods, okay? So bulk foods will have in them a lot of roughage per se, and they are good for poisoning. Like if somebody has taken small pieces of broken, glass, okay? So those small particles, because the bulk food forms a mesh, and so in that mesh, the particles get entangled and they are some kind of arrested or imprisoned, and so they reduce on the damage of the GIT. Then of the antidotes, we have what we call the physiological antidotes. And these are substances which produce exactly the opposite action to the poison. So they are antagonists, okay? They antagonize. Like in atropine, we use atropine in organophosphorus poisoning, okay? Because it's going to block those receptors. Then you can use naloxone, for instance, in morphine poisoning. If somebody has taken an overdose of morphine, you can use naloxone as an antidote because it will block the receptors where morphine actually acts. Then we have also the chelating agents. Okay, so chelating agents, these are substances that act by forming a stable and soluble complex. So if somebody has been poisoned with, say, a heavy metal, a metallic poison, so what happens is that the chelating agents will bind to that poison and make a form a complex. But this complex is soluble enough so that it can easily be excreted through urine. So those are chelating agents, and there are so many types of chelating agents. We have what is known as the British anti-levisite, or the bar antidote, or the ethylene diamine tetraacetic acid, the editor, or we have the DMSA, dimethylcaptopuric acid, succinic acid. All those are types of chelating agents. Then we have some which can enhance the elimination of the toxins from the body, the methods that can help to eliminate. And this can be done by urinary alkalinization. And this is also known as alkaline diuresis. So you increase the pH of the urine, and in that way it's able to also eliminate the poison through diuresis, through frequent urination. So IV carbonates do just that. Potassium levels in that case, they go down, and so it's always recommended that you have to supplement with potassium if you are using urine alkalization process. So the indications for this type of poisoning is that poisoning with the chloropropamide or phenobarbital or salicylates such as acetylsalicylic acid is very effective when you are using urine alkalinization. Then we can enhance the elimination of the poison from the body through other means, which include extracorporeal techniques. Extracorporeal techniques means that diverting the blood from the system into another artificial organ and then back into the system. So you can use, for instance, hemodialysis, which can be considered for poisoning with salicylates or glycol or methanol or ethanol or lithium. As you can see from the diagram here, you can divert it and filter it in here, filter out the poison and then return the blood to the body. Or you can use hemoperfusion. Hemoperfusion can also be considered for poisoning with drugs such as phenobarbital or carbamazepine. These are antiepileptic drugs. You can also use it for poison in drugs like theophylline, which is a bronchodilator drug. Okay, so in terms of the antidote, specific antidotes, you need just to at least know some of these things, and you can read more about them. And this is the last slide that we are having, and you need to master it very well because we have the specific poison and we have the antidote. For instance, if somebody took an overdose of paracetamol, what type of antidote can you use in a clinical setting? So acetylcysteine is an antidote of choice where there is acetaminophen poisoning. What about if the poison involves acetylcholine esterases or physiostigmine? So the antidote that is required there is atropine, because it's going to block the receptors where these drugs work. What about if somebody has an intoxication or has been poisoned with iron salts? So the ferroxime is an antidote of choice. What about if somebody has been poisoned with methanol, for instance? Maybe has taken methylated spirit, you know? So ethanol is one of those. Once you take ethanol, it facilitates the elimination of methanol. So ethanol remains in the body, which is not very toxic, but methanol gets eliminated from the system. Somebody who is poisoned with mercury or lead, this is where we use now chelating agents. The editor that we mentioned, the DIMSA that we mentioned, these are the chelating agents that can be used. Somebody who is poisoned with narcotic drugs, such as morphine, you need drugs like naloxone. These are specific antidotes that can be used. And for those that have been poisoned with the antimuscarinic drugs or anticholinergic drugs, the physiostigmine is a drug of choice. Okay? If somebody has been poisoned with, say, atropine itself, so physiostigmine will be the drug of choice or an antidote of choice. Okay? So, hello, are you able to hear me from that end?
Yes, sir.
Yes, sir.
Yes, sir.
And I'm running out. I'm just remaining with 10 minutes. So this is the last slide where we are looking at the specific antidotes. If it and cholinergics, then you use the paroxysm, which can be used to as an antidote for such type of poisoning. So this is what we had on how you manage poisoning clinically.